Hi, I'm Cheryl Ballantyne. I'm the coordinator for the CNA program here at Blackhawk College. What I love the most about teaching CNA is having students right from the beginning not knowing a whole lot about healthcare, and by the time they get done with CNA courses, they're taking care of people and they're just ready to work. And so that's a lot of fun watching that kind of growth. A CNA is a person who is helping the nurse and performs delegated tasks, things that are basic nursing care, whatever the nurse might do, such as helping a person bathe or helping a person eat, getting dressed. All those what we call ADLs are things that you do to get ready in the morning, you know, all the activities that we do to get ourselves ready and dressed and going. CNAs also will collect some specimens and will take vital signs such as pulse and respirations and blood pressure. So any of the basic care that the nurse decides can be done by a CNA, the CNA will do that. Our CNA students can pretty much get a job before they get out of class if they'd like to. There's a high demand for CNAs all the time. Hospitals, long-term care centers, assisted living, and even home care employs CNAs. And I get many calls every week for people that are looking for CNAs. To become a student in the CNA program, you need to be 16 years of age or older, and you need to have a clean criminal background. We do fingerprint background check our students prior to them coming into the program, so that is part of the duties of being a CNA, is to have a clean criminal record. I would encourage anybody who's interested in pursuing a career in healthcare or who would like to get into nursing to start with CNA. It's a wonderful program to introduce you to the basics of healthcare, the vocabulary of healthcare, and getting to work with patients on a one-to-one basis. The CNA program has a wide variety of students. We have students anywhere from high school students, 16-year-olds just starting out, to people that are middle age or even a little bit older that are making a career change in their lives. A CNA student should have some motivation to go into a health profession. They should enjoy working with people. That's what we do, is every day we're working with people. And they should enjoy learning new things. Blackhawk has excellent quality in all of their healthcare programs. We have very limited class sizes so that the teachers can get to know the students and the students can get to know the teachers, and we find ourselves working very closely together, so it becomes very good for students who are trying to learn new skills. We have a brand new health sciences building here on the Moline campus, which really helps us out. Our students learn in a variety of places. We have classroom learning, where the students are learning sitting down at desks, but we also have simulation, where the students get up and they go over to the bedside and they learn how to care for the patient. It's a hands-on experience for students. Also, in our healthcare programs, we have clinical time where we go out and we work with actual people from the community, patients or residents in nursing homes. I think that most people describe some of the highlights as getting to go out into the clinical area and actually care for residents. Working right alongside with the other CNAs and the other healthcare team members, and caring for and getting to know the residents. It's just a lot of fun. That's something that everybody describes as some of their favorite things to do. I decided to teach CNA because I started out teaching in nursing and I really enjoyed that. CNA was a little bit of a branch in that same direction, and I've just enjoyed getting to know the students on a very one-to-one level, a basic level, where we're learning right from the beginning, and that's been a lot of fun for me. We love hearing from our former students. From time to time, we get updates from them, but oftentimes when we're going out and taking a clinical group out into the facility, we'll see our former students, and our former students will help teach our new students as well.